Unbeknownst to many, an ooky little aspirin may mean the difference between life and death when it comes to a heart attack. For years, it has been hailed as a lifesaver, but recent updates show it's not for everyone, and taking it the wrong way could do more harm than good. Stay tuned as we expose the life-saving benefits of aspirin, the risks doctors warn against, and whether it's right for you. Aspirin, scientifically known as acetylsalicylic acid, is one of the most widely used medications in the world, with a history that dates back over a century. Its primary function is as a blood thinner, helping to reduce the risk of clots forming in the bloodstream. Blood clots form when platelets, tiny sticky cells in your blood, gather at the site of a blood vessel injury. While this process is essential to stop bleeding from cuts or wounds, it can become dangerous if platelets clump together unnecessarily. This can lead to a clot that blocks blood flow in critical areas like the heart or brain, potentially causing a heart attack or stroke. Aspirin works by interfering with the activity of an enzyme called cyclooxygenase 1, COX1. This enzyme is crucial for producing thromboxane A2, a chemical that makes platelets sticky and prone to clumping. By inhibiting COX1, aspirin reduces the ability of platelets to stick together, thereby lowering the likelihood of clot formation. Preventing clots is especially critical for individuals with cardiovascular risk factors, such as atherosclerosis, the buildup of plaque in arteries, making them prone to rupture and clot formation. Previous heart attacks or strokes, where the risk of another clot remains high. Angina, chest pain caused by reduced blood flow to the heart. By keeping the blood flowing smoothly, aspirin helps ensure that oxygen and nutrients reach the heart and brain without interruption. Explain how it works. By inhibiting platelet aggregation and improving blood flow. Aspirin inhibits platelet aggregation by targeting cyclooxygenase 1, COX1, an enzyme that plays a key role in the production of thromboxane A2. This chemical messenger signals platelets to clump together, initiating the clotting process. By blocking TOX1, aspirin reduces thromboxane A2 levels, making platelets less sticky and less likely to form clots. This mechanism ensures that blood flows more freely through the arteries, reducing the risk of dangerous blockages. For individuals with narrowed or damaged arteries due to conditions like atherosclerosis, this thinning effect is particularly vital. Improved blood flow minimizes the risk of oxygen deprivation in critical organs such as the heart and brain, helping to maintain proper function and reduce the likelihood of life-threatening events. Benefits of aspirin for preventing heart attacks and strokes. Aspirin's ability to prevent clots makes it a cornerstone in managing cardiovascular health. For individuals at risk of heart attacks or strokes, aspirin provides several important benefits. Reduced risk of heart attacks. By preventing clots in the coronary arteries, aspirin lowers the chances of a blockage that could lead to a heart attack. Protection against strokes. Aspirin prevents ischemic strokes caused by clots blocking blood flow to the brain, reducing the likelihood of severe disability or death. Secondary prevention. For individuals who have already experienced a heart attack or stroke, aspirin helps reduce the risk of recurrence by maintaining better blood flow. Support for high-risk patients. Those with conditions like angina or a history of bypass surgery or stent placement benefit from aspirin's protective effects. By maintaining open blood vessels and improving circulation, aspirin ensures that vital organs receive the oxygen and nutrients they need to function properly, reducing the burden of cardiovascular diseases. How aspirin protects you from heart attacks and strokes. Aspirin plays a crucial role in reducing the risk of heart attacks and strokes by preventing the formation of blood clots. These clots typically form when platelets, tiny cells in your blood, clump together, especially in arteries that are already narrowed by plaque buildup. While this clotting process is necessary to stop bleeding from injuries, it becomes dangerous when it blocks blood flow to vital organs. By inhibiting the production of a chemical called thromboxane A2, aspirin reduces the stickiness of platelets, making it harder for them to clump together. This simple yet powerful action ensures that blood flows more freely through the arteries, significantly lowering the chance of blockages that can cut off oxygen to the heart or brain. For people with risk factors like high cholesterol, high blood pressure, or diabetes, this ability to thin the blood and improve circulation can be life-saving. Why aspirin is essential after a heart attack or stroke. For individuals who have already experienced a heart attack or stroke, the stakes are even higher. Damage from these events often leaves arteries more vulnerable to future blockages, as plaques become unstable and prone to rupture. In such cases, aspirin becomes a key player in secondary prevention, helping to ensure that history doesn't repeat itself. By preventing clots from forming on unstable plaques, aspirin reduces the risk of a second heart attack or stroke. This is especially critical for patients who have had medical interventions like stent placements, bypass surgeries, or other cardiovascular procedures. With proper medical guidance, continued aspirin therapy helps maintain smoother blood flow and offers peace of mind for those living with heightened cardiovascular risks. The incredible journey of aspirin, from willow bark to modern medicine. Aspirin's story began thousands of years ago, long before it became a staple in modern medicine. Ancient civilizations, including the Egyptians and Sumerians, discovered that boiling the bark of the willow tree produced a brew that could ease pain and reduce fever. Even Hippocrates, the father of medicine, recommended its use for aches and discomfort. Fast forward to 1897, when German chemist Felix Hoffmann, working for Bayer, refined the active ingredient in willow bark into acetylsalicylic acid. This innovation turned an age-old remedy into a pharmaceutical breakthrough, marking the birth of modern aspirin. Doctors quickly embraced this tiny pill for its dual ability to relieve pain and reduce inflammation. As science advanced, aspirin's potential expanded to prevent heart attacks and strokes, cementing its place as one of the most effective and widely trusted medications in history. From its natural beginnings to its role in saving millions of lives, aspirin's journey is a testament to the power of simple solutions. The discovery of aspirin and its ancient roots. The story of aspirin begins thousands of years ago with a natural remedy discovered by ancient civilizations. The bark of the willow tree, rich in a compound called salicin, was used as a treatment for pain and fever as far back as the Sumerians and ancient Egyptians. Historical records show that these early healers would boil the bark to create a brew that provided relief from inflammation and discomfort. Even Hippocrates, the famed Greek physician, recommended willow bark to ease pain and reduce fevers, laying the groundwork for one of the most significant breakthroughs in medicine. Fast forward to the late 19th century when German chemist Felix Hoffmann, working for Bayer, synthesized acetylsalicylic acid, creating what we now know as aspirin. This refinement marked the transition of a traditional natural remedy into a pharmaceutical powerhouse. Hoffmann's work was groundbreaking, offering a standardized, reliable, and more tolerable form of the active ingredient found in willow bark. In the early 20th century, aspirin quickly became a cornerstone of medical practice. Physicians, often referred to as old doctors, relied heavily on it as a foundational treatment. It wasn't just for relieving headaches or fevers. Aspirin was celebrated for its versatility in managing pain, inflammation, and even early cardiovascular conditions. For decades, it was regarded as a miracle drug, trusted by doctors and patients alike. Common misconceptions about aspirin. Despite its long history of use, aspirin has not escaped misconceptions. One of the most pervasive myths is that aspirin is completely safe for everyone, largely because it is available over the counter. This assumption stems from its wide availability and long-standing reputation as a household medicine. However, the truth is that aspirin, while effective, carries risks that can have serious consequences if not used appropriately. Is aspirin really safe for everyone? The notion that anyone can take aspirin without consulting a doctor is not only incorrect, but also potentially dangerous. Aspirin works by thinning the blood, which can be beneficial for preventing clots, but also increases the risk of bleeding. For some people, this risk outweighs the benefits, especially if they have underlying conditions or are already taking other medications. Without proper guidance, individuals may unknowingly expose themselves to complications such as gastrointestinal bleeding, which is the most common side effect. Aspirin can irritate the stomach lining, leading to ulcers and bleeding that can become life-threatening. Beyond the digestive system, there's also a risk of brain bleeding, particularly in individuals prone to strokes or head injuries. These risks are why medical advice is critical, even for a medication as familiar as aspirin. By understanding these potential dangers, we can see why aspirin, though incredibly useful, is not a one-size-fits-all solution. Consulting a healthcare professional ensures that its powerful benefits are harnessed safely and effectively. Why the guidelines for aspirin use have changed. In 2022, the U.S. Preventive Services Task Force, USPSTF, revised its recommendations regarding aspirin use, especially for primary prevention of cardiovascular diseases. Previously, aspirin was widely advised for individuals over 50 to reduce the risk of heart attacks and strokes, even without prior incidents. However, updated research revealed that for many people, the risks of aspirin outweigh the benefits of primary prevention. The main concern lies in aspirin's potential to cause gastrointestinal bleeding or even brain hemorrhages, especially in older adults. Since advancements in cardiovascular care, such as better cholesterol-lowering medications and blood pressure management, have reduced the overall risk of heart disease. The benefit of aspirin for those without a history of heart problems has diminished. Primary versus secondary prevention. What's the difference? The distinction between primary and secondary prevention is critical in understanding aspirin's role. Primary prevention refers to using aspirin to prevent a first heart attack or stroke in people without diagnosed cardiovascular disease. In these cases, the bleeding risks often outweigh the benefits. Secondary prevention applies to individuals who have already experienced a heart attack or stroke or have significant arterial plaque. For these patients, aspirin remains a vital tool to reduce the risk of recurrence. Who should avoid aspirin? While aspirin can be life-saving, it isn't suitable for everyone. Individuals with the following conditions should generally avoid it. Bleeding disorders such as hemophilia increase the risk of uncontrolled bleeding. Aspirin allergies can lead to severe reactions like difficulty breathing or skin rashes. Peptic ulcers or gastrointestinal issues, as aspirin can irritate the stomach lining and cause significant bleeding. In addition, aspirin is not effective for certain conditions, such as atrial fibrillation, AFib. Although AFib increases the risk of stroke, its clots form differently, and more potent blood thinners like warfarin or NOACs, e.g. Xarelto, Eliquis, are recommended instead. The role of aspirin in emergencies. Aspirin remains a critical tool in suspected heart attack scenarios. If you experience symptoms such as chest pain, shortness of breath, or extreme discomfort radiating to the jaw or arm, taking aspirin can help. Chew a full-strength aspirin tablet, 325 mg, immediately, as chewing allows for faster absorption into the bloodstream. Call emergency services immediately after taking aspirin to ensure timely medical intervention. This simple action can prevent a clot from fully blocking a coronary artery, potentially saving your life. Natural alternatives to aspirin. For those looking for natural options, several foods and supplements have blood-thinning properties. Garlic contains allicin, which reduces platelet stickiness. Fish oil, rich in omega-3 fatty acids, which lower inflammation and improve circulation. Ginger acts as a natural anti-inflammatory and mild blood thinner. Turmeric contains curcumin, which can prevent clot formation. While these options are beneficial, they are generally not as potent as aspirin and may not be effective for individuals at high cardiovascular risk. Always consult a healthcare provider before replacing aspirin with natural remedies, weighing aspirin's benefits and risks. To decide whether aspirin is right for you, it's essential to balance its benefits against the potential risks. For people with existing cardiovascular issues, the benefits often outweigh the risks. However, for those without a history of heart disease, especially those over age 70, the risk of bleeding complications may be too high. This decision should always be made with guidance from your doctor, who can assess your individual health profile and make tailored recommendations. Taking care of your heart beyond aspirin. Aspirin is just one piece of the puzzle when it comes to heart health. To protect your cardiovascular system, eat a balanced diet. Focus on fruits, vegetables, whole grains, and healthy fats like olive oil and fish. Exercise regularly. Aim for at least 150 minutes of moderate exercise per week to strengthen your heart. Manage stress. Practice relaxation techniques such as meditation, deep breathing, or yoga. A healthy lifestyle works in tandem with any medical treatments, ensuring the best possible outcomes for your heart. If you found this information helpful, share it with your friends and loved ones on WhatsApp. Small changes can make a big difference in someone's life.